My experience with step therapy in my medical practice has not been positive. We have delayed patients their proper treatments, at times putting patients at risk with medications that we feel are not appropriate because there are other medicines that we feel would be safer for that patient or maybe work better, yet we have to go by what the insurance is mandating that we use in that particular patient based on their step therapy that they came up with, which is pretty much cookbook medicine. Certain patients that maybe have a contraindication to a certain drug. For example, I have patients who have family members with multiple sclerosis, and one of the early step therapies for rheumatoid arthritis is drugs that target TNF, tumor necrosis factor. We know that those drugs increase the risk of multiple sclerosis in patients that have family members with multiple sclerosis. So while it doesn't say that in the package insert, we're university-trained, board-certified rheumatologists that know what you can and can't do for these patients and what drugs will put these patients at risk, yet the insurance companies are mandating that we use that drug regardless of what the patient history is. That's one example. Patients trust the doctor to really make the best decision as to what's best for them. Our hands are tied, and I tell my patients frequently that the hardest thing for me is not diagnosing them. That used to be the hardest thing, diagnosing a patient. The hardest thing is not figuring out what treatment to put them on. The hardest thing now is getting them on the treatment we feel is appropriate. And patients come to you because they feel you're going to do what's best for them, and sometimes the insurance gets in the way, and they're not allowing us to treat the way that we were trained and treat the most appropriate way. If we can bring attention to this, maybe we can make some changes.